Hello, my name is Deniece Winston, and this is my capstone and 5-year plan for Lamar University Nursing 4580 Synthesis of Professional Nursing with Dr. Nancy McAfee for the fall of 2018. I graduated from a private ADN program in Michigan in 2012, so I've been a registered nurse for 6 years now. I will complete my baccalaureate in nursing in December of this year. Organizations I'm involved in are the Texas Nurses Association and Association of Perioperative Registered Nurses. My certifications include my BLS and my ACLS. My work experience are the following. I've worked med-surg telemetry units. I've worked on a kidney pancreas transplant unit, which was very interesting to me. I've worked LTAC, pediatric home health, progressive care unit, and the operating room, which I'm currently in now and have been in for 3 years. Objective 1, Humanity and Society. And the outcome of this was practices safe and effective holistic patient-centered care to a variety of patients/clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. We were to demonstrate the components of a holistic health assessment across the lifespan. I felt this was accomplished through the Nursing 4316 Comprehensive Holistic Health Assessments online through Shadow Health. On Shadow Health, we had multiple patients with different ages, ethnicities, genders, just different people all across the board. And the goal was met at 100%. Objectives 2 and 3 are combined: lifespan, health, and continuum. We supported patients/clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I felt like this was accomplished through Nursing 4321, Nursing Theories, and online education. Through our Focused Insight essay, where we discuss multidisciplinary approaches in areas that we worked in. We talked about the model of behavioral changes and different nursing theories. This goal was met with an 86%. We also evaluate patient-centered care for patients/clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. This outcome, we examine the nursing care of adults with compromised health states within the framework of the nursing process, including expected and unexpected responses to interventions. I felt like this goal was met through Nursing 4620 Practice, Comprehensive Multiple Health States online. Through our practicum reflections 1 through 4, we picked a book and someone to interview with a multiple health state, and we compared the patient that we interviewed to our book and their expected outcomes and what they didn't expect to happen, as well as interventions, and evaluated how they processed through their multiple health state. This goal was met in about an overall 88%. Objective 4 is evidence-based practice and clinical reasoning. Synthesizes clinical reasoning and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I felt this goal was met through Nursing 4390, Nursing Inquiry Evidence-Based Practice, where we describe the importance of evidence-based practice to patient outcomes through our quantitative research article critique. My article I chose to critique was patients' attitudes towards HIV testing done in dental settings. I had kind of a 50-50 response on it, which was pretty surprising to me. Some people were okay with it and some people weren't. But that goal was met at a 92%. Objective 5, patient/client-centered care. Employ safe, effective, patient-centered using theories and evidence-based findings in collaboration with patients/clients and members of the interprofessional and intra-professional healthcare team. We promoted caring, healthy communities by assessing resources, including the impact of current client technology and informatics on the delivery of interprofessional and intraprofessional care in the community. I felt like this outcome was accomplished in Nursing 4540 Practice Care of Communities Online through the Unit 1 DVD 1 Disaster Preparedness Assignment. In this assignment, it was for disaster preparedness, so we had to make sure that our clients were prepared for the disaster. They had their medications. They knew what medications it was, how they should be stored. Did they have food, water? Did they have shelter? If they had shelter in place, did they have numbers for pharmacy if they needed it, family members? If they were in a wheelchair, did they have wheelchair access? Did they have power? Just everything they needed, pamphlets, everything in case a disaster struck. I felt this goal was met at 100%. Objective 6, professional roles. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients/clients as a member of the interprofessional and intraprofessional healthcare team. We analyze appropriate written, verbal, and technological communication with patients as a member of the interprofessional and intraprofessional healthcare team. And again, I felt this goal outcome was accomplished with Nursing 4580, Synthesis of Professional Nursing. And this, it was accomplished through the Practicum Discussion 1 with Baby William. Baby William's situation had many healthcare providers from the resident down to the nurse and pharmacy that just were not educated enough to go from adults to pediatrics, which caused Baby William to become hyperkalemic. This goal was met at 98%. Objective 7 is professional roles continued. It demonstrates professional integrity, effective communication, active inquiry, and service to the community. They analyze the organizational structures and management processes of the United States healthcare system as a provider of patient-centered care for individual patients, families, populations, and communities. I felt this was accomplished through Nursing 4550, Practice Leadership and Management in the Healthcare System. Discussion Board 1, Nursing and Healthcare Environments. Nursing and healthcare environments just talked about health risks in our communities ourselves. We were to go around our own communities and observe our population, their age, and what type of health hazards presented itself in our community. I felt this goal was met at a 97%. My 5-year plan. For 2018, I plan to graduate with my BSN from Lamar University. 2019, to obtain my Certified Nurse Operating Room certification and stay at my current facility, continue to work in the operating room. And I also want to apply to a graduate school for adult gerontology primary care nurse practitioner program. 2022, I wanted to graduate from that nurse practitioner program and find an office to start working out of, hopefully within my current healthcare system. And in 2023, I want to try to open up my own clinic. My references for this program included my CNOR and Lamar University undergraduate handbook. Thank you.